Welcome back. You've heard me talk before about the struggles we've had bringing trauma services here to Ventura County, how impressed I've been with our neurosurgeon, Jay Herman. He was on this show talking about the education of a neurosurgeon, and on our YouTube channel, that has been the most popular show I've ever seen. So many people are curious about what happens inside a doctor and when they're driven to really bring something to this world. And with me today is Dr. Tom Duncan. And Dr. Duncan, tell us what's been your passion here for the last several years now, trying to get this program up and going, and now that it's up and going, we'll talk about that too.
Well, it's been a little bit of a struggle to get to this point, but we've finally gotten here. In Ventura County, we've been trying to develop a trauma system for several years. It took lots of meetings between all the different facilities in Ventura County, as well as the EMS, and we've finally been designated as a trauma center at the Ventura County Medical Center.
So I heard the word system, and EMS is, what does EMS stand for?
The Emergency Medical Services.
So we have a system of care, so how does this system set up?
It's set up in such a way that if a trauma patient is injured, the alert goes out to the Emergency Medical Services such that they're alerted to respond to that call, and they call into the base hospital, which could either be the Ventura County Medical Center or Los Robles Hospital, which are both trauma centers in Ventura County. And they decide based on the type of injury whether or not to be taken to the trauma center or whether the patient can go to a regular non-trauma hospital.
I know I just went through California motorcycle safety training. My daughter and I are going to ride, and I'd say 6 hours of that were all about safety. What kind of trauma do we see here in Ventura County?
We see a multitude of trauma victims ranging from motorcycle crashes. Actually, that's one of the most kind of injuries we see, patients who are driving around on motorcycles and for some reason or the other either slip and fall or are hit by cars. In addition, we see patients who are riding skateboards and fall off skateboards. Most of them don't have on helmets, so we have a lot of head injury patients. In addition, we have penetrating trauma, which involves stab wounds, gunshot wound victims, which is about 15% of our main trauma care.
Well, for these kids who are on the skateboards, anything you give them when they go home to prevent?
Well, if you come into the hospital and you're involved in a head-injured case and you have no helmet on when you come into the hospital, either if you're riding a skateboard or riding a bicycle or even a motorcycle, you get a gift as a helmet when you're going home.
Yeah, I know that trauma is a lot of repeat business. Those risk-taking kids tend to be back at there. Are there any laboratories that you draw? Any other risk factors for trauma?
Yeah, we do. Over the age of 14, we check your blood and your urine for drugs, such that in the event that you have drugs or alcohol in your system, we can intervene and make sure that it's not a repeat occurrence, or we direct you to the appropriate person or social worker or the psychiatry department to talk to you. That way you can get involved in a program to eliminate or decrease the amount of involvement that you have in alcohol-related incidents.
So as a surgeon, I mean, we don't really think of you guys as anything but a good set of hands, and yet here you are giving out helmets, trying to prevent people from re-injuring themselves with alcohol abuse. It sounds like you've really got a total program, but how do you know how your program's doing? I mean, you guys just go in and take out spleens, and do you really care about outcomes? I mean, you get a chance to heal with steel.
Yeah, we do. We care about outcomes, and we look at the type of injuries that we have, which is the most that we see in our system. We look at those injuries and go out into the community to do what's called prevention, and we give lectures to individuals such as the military base in Point Mugu. We've gone there several times to give lectures about motorcycle safety. We also partner with several organizations in Ventura County, Safe Kids and Every 15 Minutes and Straight Up. So we go into all these different high schools and organizations to help out preach prevention.
Well, at one point we were looking at just car accidents, non-injury, and found that most of them were concentrated within about 1.5 miles of high schools. I guess as they're stepping on the gas, leaving there, crashing into each other. But some of you named some other programs there. I don't know straight up, and what are some of these other programs?
Well, straight up has to do with reenacting exactly what happens in parties. For example, the amount of alcohol and drugs that are available at parties involving teenagers. This organization has actors and actresses that are teenagers that reenact all these events, and it's done before parents, such that the parents know exactly what their kids are going through. In addition, every 15 minutes is an organization that has to do with the CHP, as well as the EMS and the Ventura County Medical Center. But it's mostly based at a high school. We're partnered with Foothill High School. And what they do is they teach kids, juniors and seniors, the importance of thinking about the decisions they make when they drink and drive, and the impact they have on other people, themselves, their friends, their families. There's an event coming up in December that will have to do with enacting some of the events that occur in a car crash. Some kids are going to be dead, some kids are going to have bad injuries, but the kids will be transported to our facility at the Ventura County Medical Center, and the parents will have to go through the motions of how it feels to be involved in one of these bad events. So I think it's a great thing to do, and there's several other organizations we're partnered with that I haven't mentioned, but we try to put our tentacles out there to make sure that we're preaching prevention. And we're in the business to heal, but we'd rather heal and preach so that we avoid unnecessary injuries.
So there's nothing like putting yourself out of business. That'd be great. Well, who is we? Who's on the trauma team? So we know we have a surgeon. Is that the end of it there? Is that all they need, or?
No, there are several people involved on the trauma team. There's the trauma surgeon. There's an emergency physician. There are nurses, at least 2 or 3 nurses. There are respiratory therapists. We have a CT tech or a CAT scan tech. We have an X-ray tech. We have a phlebotomist. We also have a social worker that shows up mostly during the daytime. And we have several other individuals that may not be involved directly, but are outside of the periphery. But generally, when you come to the emergency department, those individuals I mentioned will meet and greet you, such that they can take care of you immediately and determine if you have any life-threatening injuries.